People, rightly or wrongly, view the influx of marijuana businesses in the same way that they view the encroachment and over-encroachment of liquor stores in their communities. There is a serious NIMBY issue, and you do yourself a disservice by clapping and applauding and demeaning those feelings. You have to address those political realities. If you don't, cities will continue their bans.
All right, going to move on to the next question. Do you believe the state will create the necessary inspection programs under the Department of Consumer Affairs, or will they delegate inspectional duties to local governments?
A lot of local governments we spoke with, like San Jose, they didn't want to actually create all the rules and regulations they created. They created them due to the lack of the rules and regulations at the state level. And so local governments, some might choose to want to do it on their own. I personally think a lot of them will defer if the state defer to the state's enforcement plan, just because it is easier, but they do have the option to do their own backup enforcement if they choose to.
Yeah, having served at the local level and at the state level, it all comes down to money, right? If you give the local governments money to do it, they're more than happy to do it. If you don't give them money, then they're like, let the state take care of it. I passed a tattoo and body piercing regulation right before I left the legislature in 2012. And before that, none of the cities and counties had any sort of overall statewide regulation. So everyone was doing their own thing, trying to regulate and license. And once we did it at the state level, we kind of created that umbrella, at least for them to follow, and then the local governments could assess their own local fees and collect to be able to implement the program where people would get trained, they'd have to get licensed, they'd have to pass a certain amount of educational requirements before they were actually tattooing and body piercing people. So I kind of see that could be the model, but again, it all depends on the money.
All right, we have a question from the audience.
Yeah, hi. My name is Karen Winston, and I appreciate Cal Heritage for putting the panel on and the panelists for taking time to be here this morning. During the conversation today, Assemblyman Cooley opened his remarks by noting the road to your future lies in someone else's head. And in addition to Mr. Smith, Mr. Lovell, and Tamar Todd's comments regarding implementation, I wanted to know, given that the Bureau Chief will act as the conductor for a symphony of interested and affected parties, what are the specific qualifications each of you think that the governor and Director Kidane should prioritize in the selection process for a new chief?
I'll just go ahead. Somebody who understands. You want somebody who can build bridges with other organizations, has the ability to reach out to Department of Food and Ag, and actually hone. They're going to be the one that actually is the glue that keeps us all together. So you're going to need to understand the industry, understand the actual medical side of this, because this is medical marijuana. So you're going to have a very strong connection to the patient world as well. You're going to have connections to besides the state legislature, rural counties. They're going to have a lot of opinions. The water boards, they're going to have a lot of opinions. And somebody who's going to be able to network all those hoops and gates or fences.
I'd be impressed if the new cannabis czar asked to go out in the field with us. To get some real hands-on experience and see some of the issues that we have to see and deal with.
Yeah, and I know the governor's office, they have been interviewing, and could be any day now that they are going to be announcing a new cannabis czar. But I agree, going out and seeing, if we had not gone out in the fields up to Humboldt, to go and see the manufacturers, everything. that is the way we learn. I would also say, utilizing best practices from other states. I think that is so important. And we are going to do a track and trace stakeholder meeting, and we're going to bring experts from other states to come in and just let us know, because we put it on YouTube where everybody can see if they don't have the access or the money to go to other states. We're going to try to bring them in here just to let us know, what worked in their state and what didn't work in their state. And I think that's going to be very helpful as well.
I would just add to that the advantage California has this time around with 215, we're first and out there. This time we really aren't first. I mean, there's a lot on the medical marijuana side. There's a lot of states that have implemented programs that haven't worked that well. That we have a lot to learn what not to do. And then I think probably more comparative is the scale of the states that have legalized and they've been implementing and what has worked and what hasn't. The person should be, first of all, there's so many different areas of expertise that's needed that they're going to need to know what they don't know and learn it and have the attitude of making it work, I think, and embracing the mission.
Move to our next question, which I think is fascinating. How will these new policies assumed under MRSA and regulations affect U.S. citizens' right to bear arms?
Okay.
How will the new regulations affect your right to bear arms, essentially?
Put on the libertarian hat for a minute. Look at me. It shouldn't actually do it. The federal government did send out a letter to federal firearms license holders a couple years ago, basically reaffirming that if somebody comes to your store to buy ammunition or a firearm and they say, hey, I'm a card holder, and they volunteer that information, you can't sell them. As a license holder, you legally can't sell them that. But other than that, in this state, there's no criminal statutes that they can use to come after you as a card holder if you're or a consumer in this state. So it's sort of a two-part answer.
I think something else we found out is that if you are applying for a CCW license, some counties, if you have a 215 card, they will not grant you a CCW license. Concealed weapons permit?
And I just thought it would be good to remind folks of what the governor told us last week when he said, don't smoke marijuana and shoot your guns at the same time.
You can drink.
Right. But you can drink. Bang, bang, shoot 'em up. Mm-hmm.
Beer though, right?
Mm-hmm.
We have a question here from the audience.
Good morning, everybody. I'm Dr. Helene Malamed, and I started my first 420 recommendation clinic a year ago. Question just for everybody, is there, in regards to the California Medical Association, is there a program to help educate the physicians out there in regards to the medicinal use of marijuana? And is there a directive of some form?
We have developed clinical guidelines that we provide to our members, and actually it's not just to our members, I believe it's available on the medical board's website. Probably needs to be updated somewhat. But no, this is, generally speaking, this is a problem that because of the limitations on research, there's been limitations on the findings, and as such, many physicians are left with not knowing, not having the comfort level that they do on other procedures and other substances. In order to recommend this, with clear conscience. Some physicians are very skeptical. So this is a big part of it. That would be part of what we suggested in the legislation last year that didn't make it, that maybe going forward folks could take a look at. Let's have some objective, for the patients, some risk-benefit information for the patients. And then let's work on sort of streamlining those clinical guidelines for physicians and promote that information broadly.
And Eduardo, since you're here, the doctors do have a lot of seminars that they go to. They're very, very busy with clients, but when they do go to educational seminars, I think it would be great if some of us were out there just talking about it, because it is not a popular topic and they don't have like a speaker series and, people who they call as experts. But, I think that would also be very good if we could just volunteer for us to come and like do a little bit of, informational education for the doctors.
All right, let's go to our next question, and this is kind of along the same lines. Why isn't our number one priority making sure that seriously ill patients have access to medicine, which they need?
I think that's CMA's priority. I'm not sure if that's everyone's priority. I think there's still sort of residual skepticism about marijuana, frankly, that despite changes in public opinion and even despite changes in some of the views of folks, up here represented in this panel, there's still a general kind of uneasiness that folks consider marijuana maybe different in some senses than other medicines. But no, I think we acknowledge CMA. One of the findings we made back in 2011 was that our current policy construct related to marijuana was a failed public policy. It just not worked, and you have huge segments of the population that have either tried marijuana or are currently using marijuana. That despite it doesn't matter what kind of law you're talking about, if you don't have general buy-in from the public, you're not going to get compliance, and therefore you got to question what the underlying purpose of the law is.
I would say expanding access is one of our number one priorities that we actually work on. It's just difficult because it's an education factor with all the other non-cannabis stakeholders in the game, explaining why we need and how it should actually look.
From a law enforcement perspective, I don't believe there's opposition to access to people with a cognizable medical need. I think what you do have, and I think Eduardo is right when he uses the word skepticism, there's a feeling that underlying the whole medical marijuana construct is people who are in fact using the drug for recreational, not medical purposes. The fact that there was a doctor last year, referred to as Dr. Skype, who was issuing recommendations every 42 seconds on Skype, and falsely telling patients, for example, that medical marijuana was exactly the thing you needed for schizophrenia, where the entire psychiatric community is unanimous that you shouldn't be doing that. And so when you have those kinds of practices, or the concert docs who are now wiped out by these laws, who show up at the concert and say, hey, before you light up a joint, give me $50 and I'll give you a recommendation. That, and I'm not picking on the doctors, I'm just picking on some isolated examples, but I think those kinds of things give rise to a skepticism among the general public. And if that skepticism, again, is treated cavalierly, then you're not going to achieve the objective of patients with legitimate medical needs being able to have access.
Yeah, and I haven't really dealt with this issue for 25 years since we left college. And most of the people we've been meeting that are actively involved, the biggest activists are the ones that are using it for legitimate medical purposes. And I've kind of changed my whole view of it, not having any friends or family, but hearing the stories, I think helps. It helps break down the stigmas. It's to the point where my dog is getting a little old now and has a little bit of arthritis. And so I'm like, well, if it works on humans, maybe it works on dogs. And it really does. Okay. I tried it, and my mother and my father couldn't believe the difference. All of a sudden, she was hopping around, and she was lively and young again. And then we ran out of the medicine for 2 weeks, and she kind of went back to the same, ailments again. And my mom's like, when are you gonna get me more? When are you gonna get me more? I mean, I don't know if I can get a 215 card for my dog, but any advice on that. But I think getting people to believe and to understand the benefits that there are so many strains, that there are so many ailments that are being healed, by this miracle plant is very helpful for those that may be skeptics.
I just want to add that I think it's important to remember that the medical marijuana system we have, and that the one that exists in all the states, is the result of, it's what's arisen, is the consequence of the federal government's refusal to acknowledge that there's any medicinal value to marijuana. It's the result of their refusal to engage in meaningful research and let doctors find out when their patients need it and how to prescribe it. And it's the result of the continued policy on the federal level and in the states of saying that an adult, over the age of 21 can use a reasonable amount of this drug for their own personal reason, for whatever reason. And given those things that are such a far departure, I think, from what most Californians believe, what most politicians acknowledge, what most doctors even know, has given rise to this system of medical marijuana to deal with both of those realities. It's not the system that you would devise if you were trying to come up with a smart, comprehensive plan to